In today's training, we're going to focus on bloodborne pathogens. This is presented by Relation Insurance, and I'm Michael Williams. All right, so for the agenda today, we're going to learn about what a bloodborne pathogen is, how infections can occur, which are called exposure incidents, universal precautions, prevention of exposure incidents, exposure incident procedures, and at the end, we'll have a 10-question quiz. So what are bloodborne pathogens? Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease to humans. Examples include HIV, hepatitis B, and AIDS. HIV. So HIV is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS, which is acquired immunodeficiency syndrome. And unlike hepatitis, HIV does not live for very long outside of the human body, and there is currently no effective cure for HIV. Once you get it, you pretty much have it for life. There are treatments, but it's something that you will always have. Hepatitis B. Hepatitis B is inflammation of the liver. When the liver is inflamed or damaged, its function can be affected. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. Hepatitis B can lead to chronic liver disease, liver cancer, and ultimately death. The hepatitis B vaccine. This is something that is offered to all employees who have potentially been exposed to hepatitis B. The vaccine is provided at no cost to the employee. And if the employee doesn't want the vaccine, they must sign a declination form, which will be kept on file with your company. It should be noted that there are no vaccines for HIV or hepatitis C. So our next is hepatitis C. This is a liver infection caused by the hepatitis C virus. Hepatitis C can range from a mild illness lasting a few weeks to a serious lifelong illness. Hepatitis C is usually spread when blood enters the body from a person infected with the hepatitis C virus. People with a new or acute hepatitis C virus infection can usually have mild symptoms, and sometimes they don't have any symptoms at all. So why are we concerned with bloodborne pathogens? So accidental contact with contaminated blood can infect a person who is providing first aid or who is cleaning up a spill of blood or other body fluid. For an infection to follow, one of the following must occur. The infected blood or body fluid contacts broken skin, so it could be a cut, rash, or just a minor abrasion, or the infected blood or body fluid contacts a mucous membrane, such as your eyes, nose, or your mouth. Either event, we will call this an exposure incident. So exposure potential. There's potential that you would be exposed to blood or other body fluid in the following ways: caring for an ill or injured person who has experienced bleeding or loss of body fluid, or during a cleanup incident following an injury or illness in which bleeding or loss of another body fluid has occurred. So universal precautions. This is one of our main focuses with bloodborne pathogens. Because you cannot tell by just looking at an individual if he or she is infected with a bloodborne pathogen, you must always treat the person's blood or bodily fluid as if it is known to be infected. So this approach is called universal precautions. We always wear the required personal protective equipment and take the appropriate cleaning and sanitation steps to prevent exposure to ourselves and to others. Any blood or body fluid should be treated as if it's contaminated. So our 5 steps to prevention of an exposure. Always wear the required level of PPE when you're responding. Clean and sanitize any surfaces that we're in contact with blood or other body fluid. Carefully remove your PPE and discard it. Wash your hands immediately with large quantities of soap and warm water. And all persons trained and authorized to respond to incidents are eligible to receive the hepatitis B vaccine. So the PPE that we're looking at, safety glasses. Safety glasses are always required for all bloodborne pathogen response. A face shield, you want to use a face shield if blood or other fluids could splash, spray, or become airborne. Disposable gloves. So these gloves are always required for our bloodborne pathogen responses. Double gloving is always recommended. It's not required, but it is a good practice. Aprons and disposable suits and shoe covers. So you want to use these if blood or other body fluid could splash, spray, or become airborne, or otherwise come in contact with the feet and body. Barrier masks and bag valve masks. These are used for CPR or mouth-to-mouth, nose and stomach breathing. So you want to use you want to use a mouth guard if you're having to perform CPR, and they should be available in a safety or first aid kit. Cleanup and sanitation. So when we're cleaning up blood or body fluids, we always wear our required PPE. Treat all spills, bandages, gauze, paper towels, etc., with the sanitizing solution used by your facility. Any material that has the potential to liberate liquid blood and or dust when dried should be placed in a red biohazard bag, and the bag be rebagged. So we're talking about double bagging here. Typically, these are red bags. These are going to be required for almost all responses because you will have on gloves, and these gloves need to go into a red biohazard bag. So this is another requirement. It doesn't really fall under PPE, but it should be just as well as safety glasses and gloves. The red biohazard bags should be required. And last, we're going to wipe up the surfaces that we're in contact with the spill using the sanitizer. So countertops, floors, machinery, tools, all these need to be wiped down with our facility sanitizer. So potential exposure events. If another person's blood or body fluid contacts your skin or mucous membranes, so remember our eyes, nose, and mouth, you want to follow these steps. Wash your skin with large amounts of soap and warm water. Flush mucous membranes with large quantities of water. So if you have an eye wash station, this would be a good area to wash your eyes out with. Report the incident to your supervisor or your program administrator, whoever typically handles injuries with your company. That's who you want to report it to, as well as your first line supervisor. You will be provided with follow-up and confidential care. So sometimes these, if you do become infected, that will become an OSHA recordable, but your information remains private. So these are private matters, but you need to make sure that you're handling this within your company. All right, so to wrap this up, bloodborne pathogens can enter our bodies through broken skin or mucous membranes. We're going to avoid an exposure event by practicing universal precautions. So treat all blood and body fluids as if they're infected, regardless of if you know somebody has HIV or hepatitis C. You want to treat all fluids as if they're infected. Providing first aid and cleanup activities can become exposure events if precautions are not taken. And safety glasses, disposable gloves, and red bio waste bags are required for 100% of bloodborne pathogen responses. And last, if you are exposed to another person's blood or body fluids, first you must wash your skin and flush the mucous membranes with warm water and soap, and then immediately provide information to your supervisor or the program administrator. All right, so last we have a 10-question quiz, and the answers will be provided to you once you complete the quiz, but we'll start these right now. So number 1, bloodborne pathogens are capable of causing disease to humans. True or false? Number 2, bloodborne pathogens can enter the human body through A, fingernails and toenails, B, broken skin and mucous membranes. Number 3, In our facility, we can be exposed to bloodborne pathogens through A, first aid and cleanup activities, B, during lunch and scheduled breaks. Number 4, we cannot tell by looking at an individual if he or she has been infected. A, true, B, false. Number 5, with universal precautions, we do the following. A, treat all blood and other bodily fluids as if it were contaminated. B, let someone else do our job. Number 6, if a medical emergency occurs and we do not have PPE, one very important action to take is A, perform CPR, B, avoid all contact with blood and other bodily fluids. Number 7, PPE is always required for responding to any incident. PPE that it is always required for responding to an incident. A, safety shoes and a hard hat. B, safety glasses and disposable gloves. Number 8, we always do this at the conclusion of an incident. A, wash our hands. B, post updates on social media. Number 9, if we think we've experienced an exposure incident, we must A, hope everything is okay. B, wash and flush the area contacted and report the incident. Number 10, all responders have a right to hepatitis B vaccinations. A, true. B, false. So your company will have the answers to go over with you from the quiz. I appreciate your time. And again, if there's any questions, you can reach out to me. My name is Michael Williams, and I am the Senior Safety Specialist at Relation Insurance. Thank you very much.